Welcome back to Medicine Deconstructed. I'm your host, Dr. Jay Rutland. As mentioned previously, we talked generally what happens to your immune system as it ages. Now we're going to get into the specifics of the T cells, the B cells, the innate immune cells, and what happens to them. Let's talk specifically right now. When looking at the innate immune system, neutrophils, which are short-lived white blood cells, show a decline in killing of bacteria in older individuals. Neutrophils may also be recruited to the wrong places, resulting in organ damage. In fact, neutrophils, macrophages, and dendritic cells have a reduced capacity to actually engulf dead cells. They can't get rid of the cells that need to go away. Natural killer cells, which essentially survey the tissues for abnormal cells, go down in number as well. Now let's move on to what happens to the T cell. Remember, the T cell can essentially become a helper T cell, which helps B cells make antibodies, or it becomes a cytotoxic T cell and binds to the pathogen or the cell infected itself. But over time, T cells may not work as well. CD8 cells are essential for antiviral and anti-tumor activity. The T cell changes that take place include a loss of naive CD8 T cells, meaning there are less cells to be told what to do. The ones that remain may be exhausted and lose some classical effector functions. CD4 cells, or helper T cells, again, the proportion of naive helper T cells declines over time as well. These cells get exhausted. They may be less responsive to activation than their younger counterparts. Remember what I mentioned earlier. CD4 T cells and B cells work together to make specific antibodies. It has been shown in the study that older CD4 T cells had fewer antigen-specific B cells and a reduction in class-switched antibodies. Well, what the hell does that mean? Well, in other words, the B cells couldn't work as well and didn't make the many types of antibodies it normally does, which it does in younger patients. Remember, the B cell is the cell that makes antibodies. So as you can imagine, it's a tough job. Remember, there's 5 types of antibodies the B cell makes: IgA, IgM, IgG, IgD, and IgE. All of these antibodies have specific jobs and locations. In this episode, we talked about how the innate immune system cells lose their function, how T cells lose their function, and how B cells lose their function as we all gain life experience. It's an important concept for us to understand, and it's even more important because this increases our risk for severe diseases like heart attacks, strokes, infectious diseases as we age. Join us on our next episode as we continue to talk specifics of inflammaging and the immune system. Thanks for joining today's YouTube episode. We'll see you next week on YouTube.